Good afternoon. Today I'm announcing an investment by St. Louis County of $4 million into technology support for virtual learning, online classroom learning for families that choose to do so. And I'm here in the Jennings School District because we need to recognize that online learning, virtual education, is not easy for every family or every student. Like every complex issue we face in St. Louis County, we have to answer a question of equity. And we're here today to try and bridge the gap for those families that can't easily access online learning. We're going to partner with the St. Louis County Library System because they already have existing relationships with our school districts, they already have existing relationships with our superintendents, and they have been working on a pilot project to get technology in the hands of families to make sure that they can participate in a virtual classroom. I want to do all we can to eliminate the barriers to virtual education. I want to do this because, as I've said in the past week, I would recommend that every family who has an option for a virtual classroom to choose that option. Families who agree with that recommendation should not be limited by access to technology. Now let's talk about where we are today. COVID cases are increasing. The virus is spreading in our community. Kids can and do get COVID-19. They can get sick. They can be in the hospital. They can lose their lives. Kids can also be asymptomatic. They can spread COVID-19 to their parents, to their grandparents, and to others. Virtual schools are a path to curbing the spread of this virus. And almost all the plans that we've been talking about and hearing from our superintendents at least include a virtual option. All schools who have in-person options are watching the virus and the statistics very closely to make sure that they will be able to go through with those plans in the coming weeks. St. Louis County has made some difficult decisions over the past few months, some tough decisions, but we have to follow these guidelines. And we have to follow the business guidelines, and we have to recognize that masks are mandatory in St. Louis County. If we adhere to these guidelines, however unpopular, including masking, then we have a chance that sometime this fall, kids will have a chance to be in an in-school setting. We have a chance to keep our businesses open. If we do not adhere to masking, we will continue to see the cases climb in our community. In addition to restrictions on youth sports, in addition to restrictions on our businesses, last Friday, St. Louis County decided that they would stop issuing permits for graduations, for proms, or any other youth activity that allows gatherings. We do need to recognize as we prepare for school that we need to do everything we can to curb the spread of the virus among our young adults and everyone they interact with. I cannot stress enough how important it is that we work together on this. I'd like to recognize Dr. McCoy now to say a few words on behalf of the plans of the Jennings School District.
I would like to thank the St. Louis County Executive and St. Louis County for this support of $4 million to the region and to students, which some of whom we have here, and students across our entire metropolitan area. I also am so thankful for our partners like the library, our corporate partners, and our physicians. Being someone who's worked with them for the past 3 months on reopening and reentry plans, it is more difficult to close down than it is to reopen. And so I want to share that public schools are only as strong as is public, and school communities are only as safe as is community, be it public, private, or parochial. As the community's safety with COVID is seemingly to not be taken as seriously as needed to reduce the amount of people contracting it, we need parents, we need adults, and we also need young people to educate themselves and to act accordingly in a way that has social distancing of 6 feet or more, masks, hand washing, hygiene, and more. We as a system have had students in school for almost a month now and have had first responders in a setting since April and have not had any contractions of COVID in our school education settings. This proves that it is possible to do, but it also proves that behaviors must change and schooling will not be anything like it was before. We foresee that it will be quite different for the next 2 years into the 22-23 school year, where rapid testing, where you can get 5-minute results back, may be more accessible to every school multiple times for every child, and a vaccine may be accessible at that time as well to all students. So we're prepared to do a few things. This money helps to support the 3 C's. That is more computer devices for every child to close the digital divide, more connectivity for broadband, and then ultimately more adult support as coaches, technical coaches, academic coaches for learning, and life coaches for this new COVID situation. Because truly, families have never had to educate their child from home using a public school curriculum or otherwise, unless you were a homeschooler. Now, this is going to be a more vital part for all of our region as we keep our community and students safe. So I encourage educators to think about having all options of virtual online learning for sure, and then think about those students who may be in neglect or abuse situations, knowing that our abuse hotlines are increasing, and knowing that some children are in neglect situations if there's not a caring adult to take care of them, or our students with special needs. And so that's why we must pilot things for our kids as soon as possible to learn the new behaviors, keep things safe, and make sure that we reduce the spread and transmission of COVID. I want to thank the leadership of St. Louis County, all of our physicians and first responders, and especially my educators who have become, many of them, contact tracers, over 30 of them, so that they know how to lead, how to prepare, and we are putting it in action. Our plans are not just plans, they are currently in action because we are studying, we are learning and planning, but we are also doing. And in our doing, we want to make sure we do what's best for each and every one of our constituents. So again, I thank everyone involved for being a great part. I would like to welcome at this time to the stage one of the key physicians, I believe, who's been a part of helping us to understand how serious COVID is and how serious it is that we protect ourselves.
Okay, well, good afternoon, everybody, and thanks for inviting me here. I'd like to thank Dr. Page and Dr. McCoy for asking me here today. You know, school administrators and regional leaders have been working a long time around the clock to come up with safe and appropriate plans for the upcoming school year. Now, we all know that no matter what, the school year is going to look different than it has in the past and what kids are used to. But all the work and change is really designed to keep them and the community safe. As Dr. Page mentioned now, though, the school year that we know is in jeopardy because of the widespread of coronavirus throughout the community. The way that we send our kids to school and our teachers to help support them and support staff back to school safely really doesn't rest with the school, it rests with the community. We absolutely need to decrease the transmission of virus in the community if we want to return to all of those things that we enjoy, such as youth sports and our kids being in schools. Now, I know many schools are exclusively offering virtual learning for at least the first part of the school year, with the option to attend in person later on, and others will be forced to follow suit if we can't turn this around. Right now, we're seeing hospital admissions climb to above 40 on an everyday basis. And to put that into perspective, just 5 weeks ago, we had 5 admissions in a day. So you can do the math. This is concerning because it means the virus is spreading and it's spreading rapidly. We have to look at what the data is telling us and act appropriately, and part of that is acting on what's best for our children as well. The simple thing, though, is that we all know what we need to do to control the virus. It's wearing masks, it's social distancing, it's washing hands, it's avoiding large crowds. You can coexist with the virus if you do these simple things. Now, we don't want to lose things like the opportunity of our kids to learn in a classroom even if on a part-time basis, and we can do that if we act right now. So I'd like to commend our local school district leaders, our teachers, and others who've really spent countless hours trying to come up with safe educational options for our children. And parents have a tough decision to make. I know that I get phone calls and emails asking what my opinion is, but every family is different. Everybody's risk is different, and everybody has to weigh those risks appropriately. How we can make the decision easier, though, is by all of us doing our part to keep transmission low in the community. Those are my concluding remarks. I do want to thank Dr. McCoy and Dr. Page for all of their leadership in this in the education, as well as around COVID in general. St. Louis County, St. Louis City, the metropolitan area, when you think about it relative to the rest of the country, we have done a good job. And so I don't want to not offer us some encouragement. We have done a good job. But now is the time to turn it around. And we can't do things like having school in person if we can't turn this around. And it's just going to take the effort from the public to get this turned around. So, thank you very much.
Thank you, Alex. Before we take questions, I want to recognize Kristen Sorth, who's the director of our county public library system, and let her tell us a little bit about their program.
Hello, I'm Kristen Sorth, and I'm the Director and CEO of the St. Louis County Library District, and we are ready to assist students and their families during this humanitarian and economic crisis. These dollars will be used to address digital equity in the region by providing hotspots and Chromebooks to students in St. Louis County. In addition, the library will provide access to online resources that provide one-to-one live tutoring services to students in K through 12th grade. We are so grateful to St. Louis County for their generous support in helping address digital equity in our region. This pandemic has impacted all of our lives, but for young people and their family, it has been particularly devastating. Providing students with digital access will give them the tools they need to be successful in the coming school year and beyond. Thank you.
We can take some questions.
Dr. Page, with this announcement, sir, does this kind of infer, as it gives school districts a nudge or suggestion that maybe we really should go all virtual?
Well, we certainly would recommend a virtual option for families whenever possible, and St. Louis County is prepared to support that decision for any school district that wants to do it. We need to watch how the cases develop in the next few days and the next few weeks before we make any sort of firm assertion, but it would be our recommendation now that the trend that we're going in St. Louis County, that we would very likely be in a position where a virtual first semester is going to be where we need to be. If we don't get masks on everyone, if we don't get folks following strictly the business guidelines, if we don't see masks more widely adopted in our community, then it's going to be very difficult for in-classroom schools in end of August and the beginning of September.
And if you see those parents like a problem, they've got a group that when they show up at the meeting tonight, I mean, their students are in class 5 days a week. What do you say to those parents?
Well, first of all, at this point, where we are with COVID in our community, we are deferring to the superintendents to make a decision that gives my recommendation personally is a virtual option for parents to choose and for schools to work with their parents, work with their teachers to see if an in-classroom option can be done safely with social distancing and masking. We also have to, we are certainly concerned about the parents who are essential workers, where virtual school doesn't work well for them. We also have to recognize that we are putting our teachers at risk if the COVID-19 transmission continues to climb in our community and we create gatherings that are not optimized from social distancing or others. I would say to parents who are concerned and teachers who are concerned that this is a very difficult time in the history of our community, a place where we haven't been before. And if we do not get COVID under control, then we will have to take measures that are unpopular and are disruptive to everyone's lives. We will have to go backwards in our public health orders and start to put more public health restrictions on activities in the community if we are not able to get universal masking and strict adherence to our crowd measures and get control of the virus in our community.
Dr. Page, this is just a bit off of the school issue. What kind of consideration are you or any other county health officials giving to more restrictions or perhaps closing some bars, nightclubs where young people gather? You're seeing spikes in the 20 to 40 age group. What kind of consideration are you giving to any restrictions or closing?
We absolutely review all of our restrictions on a daily and weekly basis, and more restrictions on bars, more restrictions on restaurants going to carry out only. Those are definitely on the table. And if we don't turn the tide on COVID in our community in the next week or two, then we're going to be making some tough decisions. We need people to wear masks. We need to protect employees at bars and restaurants. We're monitoring them. We're reviewing complaints of violations. We're sending warning letters. We're monitoring their activity. Bars and restaurants have license, and because of that, the license, they are subject to rules and regulations of the county health department. We understand that we're in a tough spot historically. The virus is moving in our community. We do not have yet wide acceptance of masking, and because of that, that's one reason. Masking and gatherings, weddings, anniversaries, celebrations, class parties, virus is moving about, and we need to get it under control, or we will definitely be moving backwards in our community.
One other question for maybe Dr. Page and Dr. Garza. The White House Coronavirus Task Force says it has sent messages to a number of cities and areas, including St. Louis, that the area needs to be more aggressive in bringing the COVID under control. Mayor Cruz says she hasn't received a call from anybody at the White House about that aggressive approach. Have you or anybody in the county received any word from the White House? Maybe Dr. Garza?
Yeah, we'll let Dr. Garza come up and answer that too. But nobody in St. Louis County has been in communication with the White House on that issue. We communicate on a regular basis with the State Department of Health and our regional health department partners, but we haven't gotten that message. But I do agree with that assessment, for sure. If we don't get widespread adoption of masking, if we don't see greater acceptance of our public health directives, then we are definitely heading in the wrong direction. And it will impact our ability to have in-person classes in schools. Yeah.
Nobody from the White House contacted the pandemic task force either.
Sure. Yeah, nobody from the White House contacted the pandemic task force, so we found out about it through the media.
I have a two-part question, probably for the county executive and the superintendent. So I think from my notes, Dr. Garza has already said the school year is in jeopardy for whatever can come. Even the last question was, there seems to be some type of room for that. If the obvious is so far in front of us right now that this could be detrimental, why not just take a bold stand and say, let's go all virtual? I know it's a partnership. Maybe the superintendent has more weight when it comes to that, and we have less, but why don't we just come with one accord and say, shut it down?
I think you're seeing school districts across the county making a decision based on the students that they serve and the particular needs of those students, how to balance the COVID in our community and the needs of some families where virtual school is very difficult. And we have to recognize that it's very difficult for some families, and that's why the county is stepping in with these technology funds. But I'll let Dr. McCoy answer that question.
This is a complex situation. It is easier to close down than it is to open up. And there are different places that are asking for 5-day-a-week schooling, such as Rockwood, which I'm an alumni from Lafayette and a former resident of Rockwood. And then there are other places that's the highest transmission zip code, like 63136, where we are present. So that's why it's important to have actual action research showing that it's possible to do, but knowing what will happen, such as, although we've opened up, we've had days with 30% attendance because you have to keep out those who have any symptoms. Every person who came through here had their temperature checked, and some of you were kept out until you had a lower temperature and said you hadn't had any temperatures because you were just, hot walking in. That happens and they don't get to come back in. And so that's a key learning. The other key structures are this. If you open up, you have to assume that COVID is in your building. So you have to have enough equipment, enough technology, and enough education and training to prevent the transmission of COVID from one kid to another or one adult to another who may be asymptomatic. It takes time and learning and action to do that, and that cannot be accomplished if you close all schools and make a decision to actually have no schooling occur. There can be no pilot, there can be no action research, and there will be neglect and abuse from those who need us most. So it's difficult to make the carte blanche decision, and it will be made when necessary to be made, but that's why there's statutes in place that ultimately give the school districts the power to still continue schooling even if the building is closed, if it comes to that. To the opposite side of the argument, in my conversation with Dr. Miles this morning with the St. Louis reentry team for reopening schools, the suggestion was made by myself and physicians, Jason Newland and Rachel from WashU, the infectious disease specialists, and others, to offer options, which Rockwood is doing, and to even consider the possibility of one space doing 5 days a week to learn and pilot if it's possible to have the safeguards to prevent transmission. Because the bottom line is we're in uncharted territory, and every school needs to study, plan, and then do before they spread it to large groups of people.
And I think it is so part of what my boss is asking to clarify.
Yes.
Why not just go back to lockdown now? I mean, I think you just explained that. Just go ahead and make it clear for the people listening to all of us.
By all means, the soundbite, definitely. It's essential to not go to a total lockdown unless it's essentially necessary so that schools can pilot, practice, and practice doesn't make perfect. Practice makes behaviors permanent. In a lockdown situation with no schools, there is no pilot, there is no practice of a plan, and it's impossible to make the right behaviors more permanent.
Wanted to ask about the parents who both work and how they're going to handle this, that their kids learning from home every day.
To the question of how will parents adapt, it was important to get information to parents as early as possible. For instance, our district shared our plan as early as the 1st of June, others in mid-July. But it's also important that schools listen to parents and try to pilot plans to meet the needs of their communities. So in our district, for instance, we have pre-K through 3rd grade coming daily. We have 4th grade through 12th grade coming every other day. And we have everyone who needs it having a virtual option with a computer device, broadband connectivity, and life coaches, the three C's, to coach them on how to educate and how to move in life during COVID. It's incumbent upon every school system to listen to those parents, have a process that allows for some service for those parents, because we're public servants paid by tax dollars. And ultimately, if firefighters, police officers, EMT responders, and others still have to go out and respond, in addition to essential workers like custodians who've done a wonderful job saving our life, then it's incumbent upon us to do something. But we want to make sure we are technically able to do that well without killing anyone or reducing the amount of deaths. It's no secret that young children have died less often, but everyone is still at risk. And so we want to serve our children, serve our families, and it's going to take time for schools to learn how to do that appropriately.
I have a question. Let's talk about the zip codes. I know we keep going with Dr. Garza said the school year is in jeopardy, but the Rockwood School District, that zip code over there, that has the highest pieces of code numbers right now. So why not just say, hey, you guys are in bad shape, let's shut you down here? I understand you just said there's certain rules and procedures in place, but you have this curriculum here that the cases are high, and that's zip code, and I don't understand that this zip code, but talk about that a little bit. Because that might be enough reference.
So I think we have to first recognize that the schools that are offering in-classroom, that may be able to offer in-school classrooms, and we're not sure yet, depending on where COVID goes, if that'll be a possibility 4 weeks from now. But the ones that do that will do that with greatly reduced classes. It's not going to be the crowds that folks are used to seeing in schools. So the question before us, as in a greatly reduced classroom, a greatly reduced volume in the school, can social distancing measures be implemented that would be safe for the kids? Nobody's going to do anything that isn't safe for the kids. And we have to recognize the balance between keeping kids from falling behind and getting them online and getting this working smoothly with the needs of the parents. It's a very difficult balance. Everyone is going to be presented with a challenge that is a struggle and inconvenient for a lot of families. And we're going to have to work through that together. But as we see COVID spreading in the community, the option of in-school classes is going to be much more difficult. But what will happen in the fall, if there are in-school classes, will be at a greatly reduced volume, and that does present an opportunity to create a system that is safe for kids and parents and teachers. And we're not yet ready to say today, absolutely, that we're not going to allow some of these other possibilities to be discussed. And that's where we are. We're talking about what the fall might look like, and we need to have these discussions because we're going to be dealing with COVID for a long time, and we need to understand where and when is it possible to have reduced classes in a school.
Is there a threshold you're looking at, when number of cases, number of hospitalizations, whatever, where you'll pull the trigger and say, all got to be online?
Well, there are many variables in the decision to close things down. We look at a lot of things. We look at testing availability, how fast are those testing results coming back to us, because an available test does not have much value if we can't get it, the test results in a couple of days. We'll be looking at our hospital capacity, but also our ICU capacity. If our hospitals are starting to increase, if this is a younger population who aren't ending up in the ICUs as much, that becomes a variable. There are a lot of pieces that go into this, but I say we're still going to be looking at hospital admissions, ICU admissions. We'll be looking not just what happens in St. Louis County, but what's happening in our surrounding counties, because they also will be using our hospital facilities, and that will also be some added pressure. So we'll be talking to everybody. We'll be working very closely with the Pandemic Task Force. We'll be following the advice of our public health officials. As of today, I can't say it's this number or that number. I can tell you that 40 admissions a day into hospitals is alarming, and if we stay on that trend, it's going to be very difficult for us to keep doing what we're doing.
Let me ask you, so you talk about inconvenience and struggle. I understand this was given some help with technology, but for those folks who have kids who learn at home, is there any kind of care that you can give to those people who are struggling to find childcare? Some people have to work 2 jobs, 3 jobs.
Yeah, right. So this is not easy. This pandemic is a very difficult time in the history of our county, history of our community, and it puts a lot of pressure on public health, puts a lot of pressure on humanitarian relief, and that's why the county has directed its resources appropriately to food distribution networks, to rent support, mortgage support, the basic needs, humanitarian needs of a family that might struggle. We have set aside in our budget $5.9 million for support for daycares. And we know that without daycares, it makes it very difficult for people to go back to work.
Let me ask another. Okay. So the conversation is always the struggle around money, but with the sports, that has been a big conversation in my newsroom this morning, but I talked to your office about it, There was an announcement last week, there was an announcement today. Under the current guidelines for summer sports, what's the impact of fall sports with regards to school? Because football would normally be practicing. So can they not practice? Can they just start league? Like, how does that all?
I'll let Dr. McCoy talk about fall sports, but the guidelines that were presented by the Sports Medicine COVID-19 Task Force and unanimously adopted by that task force, adopted by St. Louis County and adopted by the City of St. Louis, all are in agreement. And they all are in agreement that social activities around sports are at risk for further spread of COVID-19 in our community and put our kids and put their parents and their families at risk. And those are social activities, team meetings, sports that draw fans. The guidelines for sports currently are limited practices with certain conditions. And as for fall sports in the schools, I want to turn to Dr. McCoy for that.
County Executive is spot on. We're in phase one where you have 10-to-1 ratio, one coach, 10 students at any time, no spectators, and 10 youth doesn't allow you really to even do football. I want to emphasize that sports is the toughest thing to really address during COVID. It's tougher than really a school setting situation because you have heavy breathing and it's hard to breathe if you're wearing a mask. You have an object that everyone touches, the same object. And so literally schools are putting in place plans like basketball, which looks like one person shooting and getting their own rebound. That's not basketball, that's horse for those that plays, and so wearing a mask while running, which we've practiced all of these things with our students who are in session. Sports is going to be difficult. You also have Misha, who's made the rule that if you've gone virtual, you cannot participate in competitive sports. So districts like Ferguson, Florissant, and Hazelwood right now don't have any students who are eligible to participate in any sports because of the option of going 100% virtual. If a school chooses to do so, then they forfeit that opportunity for their children to play and compete as a part of Misha. But we're in phase one with limited interaction, limited numbers of students, no games, only workout kind of drills, and regular cleaning of every device that's been touched or every ball or object.
Did you say that if the parents choose for their child to go virtual?
If the school system chooses to go 100% virtual, then the Misha rule is that the child cannot participate if they attend that school, and that includes private and parochial. So, other schools are included, all schools. If your school is only virtual, then you do not qualify to play competitive sports under the Misha rules currently.
But what if I want to keep my kid virtual? Can I still keep my kid on the team, or do I want something different?
Yes, the school system has the power to keep the team, keep the child on the team, have the child be virtually educated, and then once the school system does some in person, then they can resume. So you're not eliminated from the team, you just cannot participate.
Dr. McCoy, how many, going back to the $4 million, how many of your students will be impacted by this, and talk about it?
So this $4 million allows for Jennings to receive somewhere in the range of $200,000 to possibly $500,000 maybe. With $500,000, every child can have hotspot broadband connectivity with the highest level of support for the entire school year. They could also have a touch screen device and or iPad type device for preschool through like second grade, which is important for your young learners. It also helps with making sure that everyone has a one-to-one situation where there's one device that can go home for each child. And that's the beauty of this time. Schools have never provided 100% equity. We've always provided access and adequate education. FAPE is free, appropriate education, adequate education. COVID is forcing us to provide equity, which means everyone gets what they need according to the level of need. It's going to be up to us to have coaches in a life coach sense, academic coach and technology coach sense that work with parents to create an environment in their home that's conducive for learning. But I also think it's incumbent upon us as school districts. We have a licensed child care facility in our school district. Other school districts do as well. It's up to those systems to provide child care for their families as needed, even if the schooling is closed for an extended period of time. That's why we're public servants. We're here to serve. So there's two categories. One category is going to reduce liberties in order for more people to live. The other category is going to actually kind of have their life and have their life's safety a little bit less safe in order for others to have the liberty to live. And so those teachers who've dedicated to coming in, which we have some here now, have made a choice to reduce the odds of them being totally safe in an isolation so that others can actually live. And others will have the option to reduce their access and liberty so that they can live and others can live. We need both. It's not an either or, it's a both and to the degree that your community needs the support that you're requesting. So school systems have done a great job planning this whole summer, and I believe with the right amount of support and encouragement, there'll be the adequate calibration to help us through the next 2 school years where we'll be dealing with these types of new realities.
Any other questions?
Yeah, I can see the county's concerned about the schools and social distancing, private business, all that. What do you say to protesters that are out protesting? A lot of them aren't wearing masks, or they might need some kind of face covering, but it's not adequate. Are you as concerned about that as you are the school zone?
Yeah, anybody out in a crowd should have a mask on, 6 feet away, and wear a mask, no matter what you're doing, inside or outside. If you're closer than 6 feet to someone, then you should have a mask on to protect yourself and more importantly to protect others from you. And
But you have the power to shut down schools, but you don't have the power to shut down the protests. That's what some people are concerned about.
well, we will continue to monitor the protests. We will continue to ask our protesters to wear masks. In the most recent protests, we have seen a much wider adoption of masks, and we will continue to make that request. If we don't see wide adoption of masks, then we'll have a conversation about it. Early on in this pandemic, mask wearing was not quite as uniform. We've seen it a lot more in our community. We've seen it a lot more among protesters in our community, and we hope that continues if there is a need for any sort of demonstration.
Dr. Bates, there's a couple of questions related to masks. One is about the governor making his elections to impose the mask mandate statewide. What do you think that is?
Well, we're seeing more and more statewide mandates in our country. And a statewide mask mandate would help us here in the region because there are other jurisdictions that are struggling even at greater rates than ours here in St. Louis County. But this continues to grow across our state, and a statewide mandate would help us a great deal. I would certainly like to see that.
You do hear people pushing back against masks. We've seen that in the press lately. Do you see that as a vocal minority, or how would you represent it?
Well, more and more people are accepting of masks across the country. It initially was, unfortunately, a partisan issue. And as we have seen wider acceptance among elected officials in both parties, then we see the mask acceptance grow more. It will continue to grow. More and more people adopt masks. People who hesitate to wear masks usually drop their hesitation when they see wider spread COVID in their community. What we need to do in our community is get masks more widely adopted before we get into trouble. Because once we make a public health decision, whether it's wearing a mask or abiding by our public health orders or a new public health order with restrictions, it takes 2 weeks for us to see the benefit of that intervention. That's the replication cycle of this virus. So when we get masks on everyone, it'll be 2 weeks before we see the benefit of that. We're approaching 2.5 weeks, almost 3, of a mask mandate in St. Louis County. We believe that will bend the curve. We just don't know if it will be enough, and we'll have to take more extraordinary measures. But a mask mandate will definitely help. Masks are becoming more widely accepted across the country when COVID reaches a level of tolerance that triggers someone's resistance to wearing a mask. Unfortunately, it still falls along partisan lines, but those are starting to break down as we watch COVID spread across the country.
I have one question. What data are you looking at to make any particular changes?
Well, we look at the situation every day. So I wouldn't point to a spot on the calendar and say, you know, we're going to do something this day, because, you know, everything that goes into a decision, including hospitalizations, ICU admissions, the availability of testing, how fast we get those tests back, compliance with social distancing measures, these all work in, and all those variables change daily. So, you know, we're going to continue to look at this. We're going to continue to make decisions about whether or not we need to roll back some of our public health orders, and we look at this every day.
Is it pretty much a warning to people that if we don't get our act together in 1 or 2 weeks, we're going to have to roll things back?
Well, I think everybody is saying that across the country. The White House is saying that, and we're saying that here in St. Louis County. If we don't get widespread max usage to the point where we can bend the curve of COVID in our community, if we can slow down the hospital admissions, then we'll have no choice. We'll have no choice to roll back these restrictions and slow this down. All right, thank you.
Thank you.